Hey everybody, Cody Barnett, Bodyworks Physical Therapy and Concussion Center, and talking to you today on our online virtual office hours about calf flexibility. So Dr. Doug had done a thing here recently about plantar fasciitis, and after that we had a lot of people bring up some questions and comments about it, and we thank you for those. But over the course of the last week I've had this come up, I think at least with half a dozen patients. And so I wanted to share it with everybody, and so you can learn about it. And basically that is, the main question is why does calf flexibility matter? It matters when we work with plantar fasciitis, it matters when we work with the knee problems, it even matters when we work with hip problems, it matters when we work with pain in the front part of the ball of your foot. And here's the reason why. We've got our flexible foam foot here. Unfortunately, our foot has lost a toe. He's been amputated, but in either case it'll serve our purpose. And what happens when our calf on the back of our leg, this works like a big pulley system. There's the pulley, the calf works like a big rope on the back of that pulley system to move our ankle back and forth. And when our calf or our Achilles is exceptionally tight, what happens is our foot hits the ground, foot goes down, and we want this shin bone to be able to translate forward like this over the foot. Okay, if that can't do that, if our shin can't translate forward, then what will happen is our foot goes there, that goes there, this gets to about there, and now it stops, and one of two compensation patterns occur. Number one is the heel will come up prematurely. When the heel comes up prematurely, that puts more pressure on the balls of our feet, and people can get what we call metatarsalgia, or pain in the bottom of your foot, the balls of your foot. Or the other compensation pattern is the foot comes down, lands, goes like this, shin doesn't translate forward far enough, and so it drives the arch down like this. As that arch gets driven down more like that, it puts load on our plantar fascia, or on the big toes we toe off. Okay, so by simply stretching our calves, what that allows our shin to do is, as our foot hits the ground, it goes like this, shin moves over like so, our foot comes off in a better biomechanical motion, or a better pattern, and then bottom line is we end up with less pain. So that's your tip for today. If you have any questions, please let us know. Please leave us some comments in the comment section, and we will catch you next week.